Let's go to Dr. Jared Ross. Jared, here's the thing. If you want to have a serious discussion coming on my show at 9:45 on a Friday, probably isn't a good idea. Just tell that to Christine. Not a good idea. I'm so ready to go. So, Dr. Jared Ross, senior fellow at Do No Harm. So we get these videos leaked that you guys leaked from Do No Harm from the University of South Florida in Mobile. I think that's where they are. An associate vice president of academic affairs, probably an oxymoron, Dr. Haywood Brown, another oxymoron, double oxymoron, brags about his slippery strategy of continuing DEI practices on the sly at the university in the face of an order not to do it. What is your reaction to this?
John, thanks so much for having me on. Yeah, we need to talk about this. Dr. Haywood Brown and the University of South Florida, which allowed him to climb to this position of power, as well as the Virginia Commonwealth University, or VCU, up in Virginia, which is who hosted him for this lecture. And they certainly have some explaining to do in this process as well. But Dr. Brown is an OBGYN who then went on to study maternal fetal medicine, or high-risk obstetrics, has had a career as president of the American College of Obstetrics and Gynecology, sat on the Council of Resident Education that is in charge of what our young doctors are taught. And he was openly discussing how to skirt state and federal law by renaming these harmful, racist, and illegal DEI initiatives to healthcare excellence and cultural enrichment. And this is part of a larger trend that we've seen, renaming this woke ideology that is already pervasive in both our medical education and all education, unfortunately, across the country.
So you're a state employee, you're a public employee in the University of South Florida. For a moment there, I was thinking South Alabama. They're in Mobile. South Florida obviously is in South Florida. So you're basically a state employee, right? So you're employed by the government of Florida, and you're given a directive: don't do this, and you do it anyway. And then you hide it and you steal it. You not stealing money, but you steal a different theme. And you do it anyway in direct insubordination of what you were directed to do. Where's the accountability? Where's the consequence for this?
Yeah, and we've seen the consequence. We've seen that he was placed on administrative leave, and then he has since resigned. However, we still have unanswered questions for the University of South Florida. How did he get into such a position of power where he was associate vice president for academic affairs, as well as vice president for institutional equity? Why did we have a vice president of institutional equity in the first place? And then in his lecture, he references we quite a bit. And so we're very concerned, while he may no longer be in this position, who else is leading this ship of continuing these racist policies at University of South Florida. And then Virginia Commonwealth University, VCU, has really not answered the questions here that need to be answered. Why are they hosting divisive racist ideology, as well as state university, or a Commonwealth University, as Virginia's a Commonwealth, on the taxpayer dollar, and skirting state and now federal law by promoting these racist ideologies here? And this really harkens back to segregation. It's reinventing racial segregation in medicine, which is the last place we want it.
Dr. Ross, how rampant is this, do you think?
Yeah, this is pervasive throughout medical education, unfortunately. At Do No Harm, we work to keep identity politics out of medical education, medical research, and clinical medical practice. And we see these DEI policies pervading through all three realms. As I mentioned, they've been renamed to access or talent or engagement. And they promote this false idea of racial concordance, this idea that the best doctor for you is one that has the same skin color and the same ethnic heritage as you. And really what matters is merit. You and I and anyone you ask, we want to have the best, most qualified doctor when we're hurt, when we have a medical emergency, when our family needs health care. We don't care about the color of their skin or who they choose to sleep with. And instead, what these policies push that we need to be seeing a doctor who has the same melanin content as we do. And it's incredibly harmful and it's clearly illegal.
How does your organization expose what is happening with DEI in medicine? Because it's kind of under the radar screen.
Yeah, we call it out in our reports. I talked about racial concordance. We have a great report on that debunks these often cited studies from Oakland, California, and out of Florida. We file lawsuits. We've recently had a successful lawsuit against the University of Washington in Washington State, one against the University of Colorado for a racist scholarship. And another one comes to mind is against Pfizer for a racist scholarship there. And then, getting on shows like yours and talking about this and raising awareness that this is an issue and this continues to be an issue. And we need to see change here, returning merit back to medicine.
Dr. Jared Ross, how do you stop this?
Stop this by speaking out about it. And by joining us. You can visit our website, donoharmmedicine.org, donoharmmedicine.org. We are a group of over 16,000 now in less than 3 years. About half of that is healthcare providers, doctors, nurses, but we welcome patients, parents, members of the concerned public. We have policymakers among our members. So we'd love to have you join us. We send out information regularly, both national and state specific, and continue to push lawmakers and people in positions of power to stop these racist policies and start bringing in doctors based on their brilliance and the quality of healthcare that they can provide.
In your research, what has been the worst offender of what you're talking about? What organization? What is there, a hospital, a college? Like, who is at the top of your wow, that's really bad list?
We see it across the board, unfortunately. I wish I could say a worst. We've seen it from the coast of California up to the Northeast to the Ivies, and unfortunately, it is really rampant here. But we are working to shut this down nationwide.
All right, good job, Dr. Jared Ross. Again, people want to follow you on your site. Where do they go, sir?
DoNoHarmMedicine.org, DoNoHarmMedicine.org.
All right, Dr. Jared Ross, thank you. Thank you for your time today, and thank you for the great work that you guys are doing. And we will see you soon.
Thanks so much for having me on, John.
And just exposing, you think about it, folks, exposing the DEI. And this guy in South Florida, this VP of Academic Affairs, basically leaking a video saying, here's how I'm going to subvert the system and totally be insubordinate. And obviously bold enough to put a video out, so he didn't think that anything would happen. I mean, it's kind of crazy. Okay, we've got